I'm Jeff Allen, the Director of Sports Medicine and the Head Athletic Trainer at the University of Alabama. Here at the University of Alabama, we stress every day the importance of injury prevention and proper strength and conditioning to all of our student athletes. We know that they have goals for their athletic careers and for their particular teams, and we're going to do everything that we can to help keep them healthy and help them to reach those goals and prevent any career-ending or career-threatening injuries that they might have. One injury that we often see, especially in our throwing athletes, is UCL injuries of the elbow. Here today to discuss with me the importance of UCL injuries and the effect they can have on athletes is Dr. Lyle Kane. Dr. Kane is a sports medicine fellowship-trained orthopedic surgeon with the Andrews Sports Medicine and Orthopedic Center in Birmingham, Alabama. As you know, Andrews Sports Medicine is the official sports medicine provider for the University of Alabama and a tremendous partner to our entire athletic department and our entire university. Dr. Kane, thanks for joining us today. UCL injuries can be a big deal for student athletes.
No question. We at Andrews Sports Medicine are very proud to be a part of the university tradition and the tradition of the sports medicine program here at the university. I specialize in sports medicine, and over the years I've had a chance to treat athletes at all skill levels, including recreational, college, and even professional athletes that have these injuries. A sports injury, as we know, can be a devastating time in an athlete's career. Many of these athletes have injuries that affect their function. They're not able to participate unless they're repaired or treated properly. We often see UCL injuries in sports, and we work with these athletes to get back to the same level of play and back to the playing field. UCL is called the ulnar collateral ligament, and most people know it as the Tommy John ligament. The reason it's called Tommy John ligament is that it was first described and first really promoted by a surgeon named Frank Jobe, who operated on a baseball player named Tommy John. Tommy John was able to return to the same level of competition and get back and pitch professionally for the Los Angeles Dodgers after his surgery, and so Tommy John is kind of the name that most people know this surgery by. The ulnar collateral ligament is a ligament on the inside part of the elbow, the medial side of the elbow, that's important primarily in throwing sports, such as baseball, softball, tennis, even gymnastics sometimes injure their ulnar collateral ligament. The symptoms generally come with throwing or overhead sports. The athlete makes a throw and feels pain and sometimes feels a pop on the medial surface of the elbow. They may have swelling and bruising of that area, and then from that point on, oftentimes they're not able to continue throwing. So the ulnar collateral ligament is very important for throwing sports and for overhead sports. Treatment varies depending on the time of the year, the level of the athlete, and what their goals are. The ulnar collateral ligament is not usually necessary for sports that are not throwing sports. So for football players, for instance, some of Jeff's guys that get hurt playing football, they don't have to have that ligament reconstructed. They can participate and continue to play football even with an injured ulnar collateral ligament. Baseball is a different sport. In baseball, you have to have that stability and have to have the tightness of that ligament to be able to throw a baseball properly. And so for most baseball players, they have to have the ligament reconstructed in order to participate in baseball and get back to the same competitive level. We treat UCL injuries by reconstructing the ligament. And the way we do that is we take a ligament either from the same forearm or from the opposite knee of the athlete, and we use that to rebuild the Tommy John ligament. The surgery takes about 2 hours to do, and the return is long. It takes about 12 months of rehabilitation, working with Jeff Allen's staff and the athletic training staff to get back to the same competitive level that they were pre-injury. But UCL reconstruction is very successful. In the days of Tommy John, the return was about 1 in 100. And today it's about 90%. So technology has really improved the outcomes, and it's important for the athletic trainers and physical therapists involved to be working with the team and the surgeon to get the athlete back on the playing field.
You know, Dr. Kane, you're seeing so many of these athletes now, and I know you treat hundreds of athletes every year, but you're seeing so many that start, especially in baseball, start so much earlier throwing, even as 8, 9-year-old kids throwing all year long. How much of an effect does that have on UCL injuries?
Well, there's no question that in 2012 we're seeing a lot more of these injuries than we did 10 years ago. And part of the goal of Andrews Sports Medicine and Dr. Andrews himself is injury prevention. A lot of these injuries occur when kids are 10, 11, 12 years old, and most of these are actually overuse injuries. So they occur not by a one-time situation, but more by repetitive use and overusing the elbow. So we try to work on pitch counts, educate parents, coaches, educate the athletes themselves that if you're fatigued or if you're having trouble with your arm, not to try to pitch through it, because you can certainly cause damage that needs surgery.
You know, we're so proud of the partnership that we have with the Andrews Sports Medicine and Orthopedic Center in Birmingham, and in particular, the relationship that we have with Dr. Kane. You know, the job that they do taking care of all of our athletes, and in particular our athletes that need surgery, makes a big difference in our ability to be successful. Thanks, Dr. Kane, for all you do.
Thank you, Jeff. We at Andrews Sports Medicine are proud to be part of the tradition of the University of Alabama. We are committed every day to trying to provide the best treatment, rehabilitation, and preventative education for these athletes. And our goal is to keep people on the field and out of the operating rooms. If you have any questions about UCL injuries or any other sports injuries, please visit our website at www.andrewscenters.com or contact us at 205-939-3699.